Hello, welcome to another beautiful episode of Healthy Living, reaching you from the nation's capital, Abuja. I am Olamide Al-Hassan, your guide through today's health program. Now, communicable diseases remain a significant public health challenge in many parts of the world, particularly in rural areas of developing countries. One of the critical factors contributing to the spread of these diseases is the lack of access to clean and safe water. Now, more than 3 billion people worldwide depend on water that crosses national borders, yet only 24 countries have cooperation agreements for all their shared waters. 2.2 billion still live without safely managed drinking water, including 150 million people who drink surface water, and that's according to WHO and UNICEF 2023. So the World Bank estimates that 70 million Nigerians lack access to safe drinking water and 114 million lack access to basic sanitation facilities. This problem is more pronounced in rural areas where infrastructure and resources are often limited. Now, addressing the lack of access to clean water is essential, especially for controlling the spread of communicable diseases and improving public health outcomes in Nigeria. Today on the program, we'll discuss lack of access to clean water in rural communities with a change advocate, Economist turned health reporter, Miriam. Stick around. The Healthy Living lady, Miriam. How are you doing today?
I'm good, and thank you.
I'm so happy to have you in the studio today. But something is baffling me about you. I'm looking at Economist to health reporter. How did that come along? Because there's no relationship in that.
Well, thank you very much. Like economics, as you know, is all about the way of life and how people do things. But then there's a field in economics called development economics, and we are passionate about developmental issues, and health is one of them. So looking at it in a way to touch lives. When you're talking about development economics, like my second degree I did in developmental economics. So when you're talking of development, it's better you go to the grassroots to know what people are actually feeling. And to get that, I felt I could get it better in reporting. By reporting, I could get to the common man in the community that nobody knows about them. And through there, you can be able to make informed policies that can capture those that are omitted from the policies that were initially made. And that was my passion for reporting on development and economic issues.
I can already see the passion in the way you were just trying to explain it and all of that. So part of what we're discussing today is communicable diseases and the lack of access to clean water in rural areas. And we know that part of the major challenges that people have today, like we're talking about cholera outbreak today, absolutely. Everybody, the death cases are increasing. We have about 63 already. That's risen, and that's a major concern. And this is an environmental issue. So now let's get your thoughts. I know you did a research in some rural areas. Let's get your thoughts on some of the things you discovered when it comes to access to clean water.
Yeah, thank you very much for that question. It's actually a very critical issue at the moment. And based on when you are talking of cholera in particular, you are talking of it is linking with the water poverty. And when you look at the issue of water poverty, it has actually been an issue in our country. And it was as if it was only in rural areas, but the narrative has now changed. It's also affecting the urban areas. You look at the case of Lagos State, for instance. The peak of this cholera outbreak, when you're talking about it, is actually emanating from there. And Lagos is not alone. FCT is also one of the, as the nation's capital, is also facing that issue. When you talk of water poverty, you look at the issue, the lack of access of clean water. When you get to communities here in FCT, like a research done by an NGO called Gender Strategies Advancement International, you see that most of the communities around FCT also lack access to clean water, which is a link to the cholera outbreak we are talking about today. So when you look at a very close community here in Apo, you talk of Taku.
Apo, really?
Yeah, Taku Shara, and you're talking about Wasa, you're talking about Karshi. They are very close to the seat of power, but they lack access to clean water. And because they lack access to this clean water based on their economic strength, they go to other options that are not really clean enough, which they are posing themselves at the risk of contracting these waterborne diseases. When you talk of cholera, you are not only emphasizing on cholera, you have other diseases like the typhoid. You have other diseases like the diarrhea. And most of the persons affected are children under the age of 5, the women, because they are more persons that are vulnerable to these practices. So the issue has actually been one of the case of Lagos has been an eye-opener to the country to see that we have another endemic that if we did not really handle it well, it would lead to another thing. When COVID came, we felt that was the only issue, health issue that we have. But cholera is showing us now that if we are not taking our water, access to water seriously, then we'll have another case, because as at yesterday, we had about 2,200 suspected cases that were registered. And when you are talking of 63 persons, this is not statistic alone. You are talking of human beings. You are talking of families that are feeling this. You are talking of people's fathers. You are talking of people's children. You are talking of our future leaders. So we must address this. And this is ongoing because the surge of the rainy season is still on, and there's need to look into this.
You know, it's quite pathetic to know that, especially when you mentioned FCT and you talked about it moving away from just rural areas to urban cities. It's actually resonating, because I remember that there's a particular community I visited. It wasn't really, should I really call it community? It's also in Abuja here. And it was just like a stone throw from my house. And I couldn't believe that this place actually existed. And when I went there, the kind of way I saw, I practically saw open defecation everywhere. And I was asking myself, this place is, let's say, 30 steps away from my street.
Yeah.
That's the way I'm going to describe it. That's to show you how close it was.
Imagine.
But it's like a cluster where people stay and they do not really care. You see them defecate openly. Their sewage tanks are not properly organized. They're not even properly covered. They just put zincs to cover them up. You see houses, the way they are built, and you ask yourself, what's the hygiene of this kind of place? What happens if, so I asked myself that day, what happens if there's cholera spiking? In fact, if one person contracts cholera in that environment, simply means that it's going to spread around, because
Absolutely.
It's a cluster of buildings and all of that. And you cannot call that place a rural area, but it's just a community attached to an environment. You know, so that truly shows me that this thing has truly moved away from just the rural areas, but also in urban cities. So now let's talk about the context and the importance of having this access to clean water. And from your reports and from the investigations you've had to do over time, what are some of the challenges that has led to this, water poverty that we experience that is now leading us to one or two communicable diseases that is beginning to spike every day?
Thank you very much for that question. Like when you talk of the challenges, there are a lot of challenges. But in some of these reports and some of the communities you visited, you see that one of the basic challenge that you see is that of economy, the economic strength. Because most of these community women, especially, I'm emphasizing on women because they are involved in this practice more. A man doesn't go to the stream to fetch water.
True.
A woman does. The children do that. So the women are not really empowered enough. And because of their lack of economic strength, they turn to other unsafe options, such as maybe rivers, wells, which they are posing themselves to contracting such communicable waterborne diseases. So you see, one of the basic things is empowerment. These women must be empowered, because the challenge is that the water is expensive. To get the cleaner water is expensive. Like if you agree with me, even in some of the suburbs in the FCT here, a truck of water that was initially sold for 700, 500 naira is now going for 1,500. And a family of 6 that is not cannot even afford that 1,500 per day that truck of water will not even be available, will not even be sufficient for that family in just a day. So imagine you are using like maybe 3,000 naira on water alone in a day. So what are the children going to eat? So the economic situation we find ourselves are also exacerbated this condition for these women. So they had no option. There's no option than to go back to those unsafe options to get water for their daily use. So in this case, we are also talking about the neglect by the government, because like from the findings of this report, I learned Abuja was supposed to supply water. FCT was supposed to supply water to about 100 million Nigerians in the FCT. But from the 8
Did you say 100 million Nigerians in the FCT? Nigerians.
And then when you talk of they were supposed to supply water in 8 loops. But since the inception of FCT, only 2 loops have been supplied. So you could imagine that these communities, they are not far from the seat of power. So they are not supposed to be neglected. So it is hard time the government invests more in water infrastructure, because there is lack of water infrastructure, supply of water, investment in water infrastructure based on this report. I would say that is also one of the challenges. The investment is not enough, because these pipelines are supposed to, the network is supposed to extend to these persons. So those are the 2 challenges based on the findings we have. I've seen that one is the economic strength, and the second is the negligence by the government on expanding the water network, the water supply network to these communities.
All right, so if we look at it from the economic strength for maybe places like the north, what about places like Lagos State? You know, I'm beginning to wonder if we're talking about maybe access to clean water, and maybe that's the reason why we have a lot of communicable diseases that are spreading. Are we also going to talk about the same case for Lagos State? Lagos is surrounded by water, mind you. So I'm wondering, what is it that is the challenge that is making Lagos the epicenter of cholera today?
Thank you so much. Like, Lagos is actually surrounded with water, as you have said, but then the water cannot take itself to the people's homes. So you discover that even in Lagos, there is challenge of access to clean water, if you agree with me, because a lot of homes still buy water from vendors. And the same issue that is identified here.
This reminds me of the time I was in the market, and then I saw people selling water. They held this.
Absolutely.
Yeah. Oh,
absolutely.
True.
So they still buy water from vendors. And if the economic strength is not there, going with our economic hardship in the country now, a lot of people that were at average class, they are no longer there. In fact, there's no average an average rich man in this country as far as I'm concerned, because the average ones have gone below the poverty line. So the rate at which Nigerians are poor now, there are some of the basic necessities that they cannot afford. So they go for the options that they feel are a bit free, which are not safe to them. So like the Lagos case, the Commissioner of Police, the Commissioner of Health, came out to said people should stop taking Zobo. People should stop taking Kunu Aya and all of that.
Yes.
Because those sellers, mind you, they are poor. And they can get water from anywhere to process those things. So you discover that because people want to survive, a man might leave his house in the morning to the market, and because he doesn't have much to get a good food to eat, he gets the kunu and take, he gets the zobo and drink, not minding where that water is coming from. And that is what is breeding cholera in Lagos State. So yes, there is water everywhere, but you cannot, even the water, the lagoons that are surrounding Lagos, you can't just go there and fetch and feel is safe. It must be treated. So even if you go there and fetch, it's not safe for you to drink. It's not healthy enough. So I think that is one of the issues. And even UNICEF came up to advocate for more access to water in Lagos State. Attributing this...
It's covered with water.
Yes, attributing this to the reason why there is surge of cholera cases in Lagos State.
This is becoming even much more scarier because you look at some of these basic amenities that citizens ought to have. Now, I'm looking at it from another angle. From your reports over the years, who do you think, who should have played a better role in giving access to some of these basic amenities? Because, you know, sometimes they say the government cannot do everything for you. So some way, some individuals also have their roles to play. And there are situations where government even does it and the citizens end up ruining it. In fact, we see what happens. The second Niger bridge, when was it, when was it commissioned? In December. And just a few months later, they're already stealing things off the bridge. So these things happen. You see where government has produced something or given a community something, and some persons have gone to vandalize it because they do not care. So who do you think has a better role or a bigger role to play when it comes to access to these very little basic things that keep them in good health?
Thank you so much for that question. Like when you talk of basic needs of man, government is responsible for that. Because when you talk of access to clean water, you talk of food, you talk of shelter, which are the basic things. All over the world, these three things, they are like what we call in economics as autonomous consumption. Whether you work, you do not work. Government is supposed to provide these basic needs to its citizens. But it's just unfortunate that, yes, government in a way is trying its best in some places to do this, but the behavioral attitude of Nigerians also matters. Because let me put it in this way, most of Nigerians, we are not patriotic enough. We don't look at what government have done as we doing it. We look at it as everybody can destroy it, everybody can get what they want. Yes, like what you are saying, like over my experience of reporting over years, I've also discovered that a lot of basic things government has done for the benefit of the citizens destroy it. But then it is still the government's role to put some measures, like let's say some security measures around some of these basic facilities to ensure that the individuals benefit from it. But then I can also say the behavioral attitude of Nigeria must also be changed, because the government cannot do all the things all the times.
Absolutely.
And when government do it, it's also the community involvement also matters, because we need to take ownership of what government have done and to ensure that we maintain it. So that is, I'm talking about the sustainability.
Yes. To
maintain it so that even the generation next to us will enjoy that. So it is true that in other places, these pipe bowl waters are there, but there are blocks. Who block them? Nigerians. You see the situation where people carry their sewage, they carry their waste, dump in sewage, dump everywhere. And a situation like in the FCT now, we have issue of this manhole removed by scavengers. That is supposed to cover some of the particles that will block some of these drainages or even the pipe lines. But we destroy it. So yes, government cannot do everything. Government cannot be everywhere at any time. But Nigerians are there. So we need to take ownership of all these things to ensure that we benefit from it, and the generation before us, after us, will also benefit from them.
What about also the role of maybe some sort of community education? In the times, I know that you've been doing these health reports and advocacy for a while, but what kind of attitude do you even meet when you get to these communities and you try to, because I'm sure, okay, for instance, the water report, How did they take it when you wanted to come into their community to find out some of the things that they do, how they use the water? Were you able to educate them to know the detriment of not having clean water for their own consumption? And what was their attitudes generally? Because I know most of the time you cannot even help someone who does not want to be helped.
Absolutely.
So that's a different case entirely. So I'd like to get to know, what was the attitude, what was the responses that you got from the communities themselves?
Thank you very much. Like you see, Nigerians are very funny. I'll put it that way. We Nigerians are very funny. We are, in most cases, we are suffering, but we don't want to speak what we are suffering out. So this issue has become a challenge. Most especially, you see, in the north, it's even more difficult. And maybe, based on my experience, I felt maybe that is the more reason why some policies are wrongly made, because the statistic or the data is not well captured. Because you see where you go to a community, you see what is happening, you want to inquire about it, to know how the depth of that. And a lot of the community members deny you access to those informations. So it's one of the basic challenge. And you see, I will even say one of the attitude of these community people, will I say ignorance? Let me put it that way. Because in most cases, like you were talking about the report and all of that. You see, in most cases, you go to a community. Yes, they are educating them about the importance of this clean water. But there are some communities that have been provided with boreholes, at least to be as a temporary solution to the lack of water in the community. But a lot of them still destroy that borehole. Some of them don't even want to fetch water from that borehole based on some norms, some cultural beliefs, and all of that.
So they don't want to use borehole because of some cultural beliefs. You see what I'm saying? Some persons have not even emancipated their minds. Like, they still feel, I'm not talking down on cultures, but why wouldn't you want something good and convenient for yourself?
Absolutely. So that is the issue. Like, let me digress a little. Like, recently I was in Zamfara State making a report on maternal child health. And I discovered a lot of these women, there is this RUT, ready to use therapeutic supplements that UN, specifically UNICEF, gives out to malnourished children. But you will be shocked that most of these women refuse to breastfeed their children because of some of the cultural beliefs and norms. They said, I don't want to, a no-no will make my child stronger. And as a result of this, these children are malnourished. So you discover that by the time these children are malnourished, they bring them to the Seaman Center. And by the time you give them this RUT to give to their children to revive these children, they go and sell it.
Oh my God.
So when you look at all these things, yes, the government is doing some of the efforts. Some of the non-governmental organizations are also doing their part. But the behavioral attitude is one of the basic challenge, especially in rural communities. Because maybe based on their educational background, or maybe the culture, as they said, is really fighting some of the efforts the government and the non-governmental organizations are doing to ensure that these people are not denied out of their rights of what they are supposed to get. Like, for instance, water is supposed to be a basic human right.
Exactly.
But a situation whereby somebody refused to take borehole water because of the culture they believe in. You can only take a horse to the river, but you can't force that horse to drink that water. So in most cases, yes, the water is there, but they will tell you that no, borehole, my God, I worship, this one I serve, does not permit me to take borehole water. Rainwater is the best. So there was one of the person I met, and the woman told me she stores water from this rainy season till next March.
Eh?
Yes, because she believes rainwater is the best. So imagine the contaminated water she has been using with her family. So this is one of the challenges too that is also fighting some of the effort, because yes, the non-governmental organizations are doing a lot to reach out to these people where government could not reach. But then these efforts are being thwarted by some of this attitude. So that is what I can say based on that.
Honestly, it's unbelievable to know that there are people who have norms, beliefs, and cultures that wouldn't give them access to clean water. So that now reminds me of a particular time that I traveled to the village to, you know, get to learn about my people. And I discovered that they wouldn't take bottled water because it was like, no. The plastic can cause you even health hazards. Do you know the chemicals that was used to produce the plastic? And I was like, there's nothing wrong with this. It's even safer for you than whatever it is that you're drinking from your stream. They said, no, once you have, even if you find leaves inside their herbs in your water, they are clean and you can drink it. It makes you even stronger. It makes you better. It makes you live longer. You know, there are people who keep that notion that the reason why there are lots of health challenges today is because we've opened up ourselves to a lot of things. We've welcomed new things too much that they are beginning to give us some of these health challenges today, which means that a lot of people are still very, very backward. A lot of people are still living in the past. But before I drop you the next question, let's quickly go on this break. And when we return, the conversation will continue. All right, viewers, I'm sure you're enjoying the conversation. We'll be right back shortly. Stick around. Welcome back, viewers. We're still discussing with Miriam, and we're discussing access to clean water and some of the challenges that it poses in rural communities today. You're welcome once again.
Thank you, Ma.
All right, so before we went on that break, I was going to come up, I know we're talking about some of the cultural beliefs that makes people digress and not want to embrace or welcome some of these things. But how do you begin to get them out of those kind of thoughts? What do you say to them? How do you end up convincing them? Do you have to see their local change? Because it may seem as though it trickles down from there to the people. So how do we begin to handle some of these cases?
Yeah, thank you. Like the only way to do this is through development, behavioral change, communication. And most of these things, you do them through their worship leaders, their religious leaders, because they believe in them so much, their community heads. And by the time they speak to them, yes, we are trying to see some of the changes in some of the communities through this. And that is why that collaboration with the religious leaders is very, very key. Because when they speak to them in worship centers, especially the Muslims, they listen to them more than what you can communicate with them. And we are also doing a kind of community involvement advocacy.
Okay.
Using the community members within them to educate them on some of the dangers of using this on safe waters. So I think it's also yielding a lot of positive results, because when they talk to them, they understand them better than a stranger going to speak with them. Because a stranger, they don't believe you that much, but they believe themselves. And that is why we have volunteers within the communities who are practicing this and then educating them through their practice and speaking with them. So I think it's yielding a lot of results. And, you know, this behavioral change, like I said, is not something that can be changed overnight. It's something that will take time. And it's one of the difficult things because it has to do with the mental ability of that individual. So the mental ability is changed over time, with time. Like you see, while I was even talking about the issue of breastfeeding, it was actually more alarming before than now. But you could see that the statistic is a bit dropping because people are beginning to buy into why it's important for them to do exclusive breastfeeding.
Yes.
Same thing with access to clean water. You see that a lot of community members now, because they are down with some of these waterborne diseases, they've spent days in the hospital. They've spent even out of their pockets, which has actually touched them. So a lot of them are beginning to look at leaving the culture or the norm they had believed in to see how they can save themselves and their children from all these diseases.
You know, I was thinking, in your years of reporting, did you come across a case where maybe a particular community has a disease outbreak and it probably has any link into this access to clean water, lack of access to clean water? Of
course, yes. Like there was a report I did at Gwako, a community in Gogolada, in FCT here. And the community was plagued with diarrhea and typhoid. And they never knew what was the reason. They kept, when I spoke to the chief told me he felt the gods are angry with them.
Oh my.
Yeah, they felt the gods were angry with them. And the health workers in that community, they actually affirmed to what was happening, that every day diarrhea is one of the things they admit every day on a daily basis, like 20 to 25 cases per day. And their children were dying, but they never knew because there was no clean potable drinking water in that community. And I asked them, how did you drink water from here? They told me there was a stream they take from Aye stream. And when we got to that stream, the man that took me there told me, this stream, there are dead bodies that they threw on the stream that float around.
Oh my God.
You just push it around. And when I got there, I saw some feces on the water. And people were there fetching it to drink. So they told me when you go to the middle, you take away those ones, you part away and then drink from it. They never knew this water was what was causing the diarrhea their children were having and all of that. And some of them, their children would drink this water, complain of stomach ache. But they say, with time, take salt. Add salt into the water, give them to take. And this was one of the cases that was very, very pathetic, but it was happening. So they complained of typhoid. The adults were complaining of typhoid. They had typhoid. They felt it was maybe the gods were not happy with them. But then I told them it was not the gods. This water you are drinking is the cause of it. And they had only one borehole, which was rusty. And they fetched that one for the chief, while the rest go to that stream to drink from there. So you see, this issue of water poverty is actually a very critical issue.
Another thing is maintenance of whatever water source that you have. Just like you mentioned that the borehole was rusty. Most persons do not understand the place of maintenance. Even some water tanks, some persons, their water tanks at home now have never been cleaned up, but they keep drinking from that water and they think they are very comfortable, they have access to clean water. Some persons, the filter attached to their water tanks have not been changed for a long while. It has not been cleaned up, it has not been washed, and they still feel like they're drinking clean water. You know, there was a particular time I heard, I saw a report that if you were to check your water with what's that device again, there's a particular lens that if you use it to check your water, you see the number of organisms that are present in that water. Exactly, the number of organisms that are present in that water, and you realize just how unsafe it is to even drink directly from the tap. How much more people that are even pushing whatever feces aside before they drink their water. Now, what's the place of adequate maintenance of your water source?
Yeah, thank you. Like you see, in our reports, we even said borehole is one of the unsaved sources of water. The reason is just those things you have highlighted. Because a lot of persons, when they dig borehole, they feel they are drinking clean water. But how well have you been maintaining? You see, the maintenance culture has always been a challenge, especially in our country. We only think of new things, but we don't think of how to maintain that to be the way it came when it was new. So it's one of the biggest challenges that we need to also look at it. Like the borehole we're inserting here, if they had known, okay, for a period of time, you check your borehole, they pump everything and change it. But because the borehole was dug by a politician in the community, and he never cared. He has given it to the community. He has forgotten about it, and nobody cares. This needs to be maintained. So until they are just drinking from it, until the day it will break down. And that is all about it. So maintenance culture is one of the basic things we need to look out for when we are talking of access to clean water. Because the government cannot go to your house to clean your tap. The government cannot go to your house to maintain the borehole he has given to you.
Exactly.
So we need to have that maintenance culture in us. As a community, we can come together and maintain what government has given to us. As individuals, we can also maintain, we can check our water after 2-3 months. We can maintain our taps to ensure that what we are drinking is actually good and is actually healthy for us. So in this case, government cannot do all of this.
Absolutely.
We need to do that. We need to take ownership of some things as people. We need to also help government, because government, when you are talking about government, is not only the elected people.
Exactly.
All of us are government. So the little you do in your own area will go a long way of helping other people also do in their own parts. And when we do that, everybody will have access to clean and safe water.
Honestly, it's really baffling to know that people do not understand the place of maintenance of their water. Now, you said part of the things, the sources of water that you mentioned was tap water. So what other sources are unsafe that people need to know about?
Yes, like we talk about rivers, we talk about wells, and we talk about boreholes. Because even boreholes, if you don't maintain it, don't think you are taking clean water. So, like the river, I've already said, there are a lot of things passing over that water. So it's not safe, it's not clean for you. Even if you fetch that water and said you are going to treat it, it is not 100% safe because the water has been contaminated. So it takes a lot of process to even purify that water. Not just buying a water guard or something else to put into the water and think it's safe for you to drink. And even the wells we drink, like if you go to many villages or communities, you see people telling you where is even neater, is safer than the tap water. But then you've forgotten some of the things that go through that water. So we need to be very careful. Even the taps that we are even talking about, there are some taps that are broken along the way. They are broken. Now, by the time the water gets to you, it's not pure. So we also need to take all these things in cognizance. We need to know that when you get water, yes, you can get tap water and still purify that water for your health. So we must take our drinking water seriously. We must ensure that any water we have, we make sure we purify it or sediment it in a way that will be sure of what is going into us.
You know, I've seen water boards try to dispense water to communities. I think I've taken note of this like once or twice or thrice. And I know that most communities depend on water boards. So they'll be like, water board is bringing water. I see trucks carrying water, but they don't even look the kind of trucks that should carry healthy water for people to consume. So who's to be blamed for that? I'm sure I'm not the first person saying this. You must have had the experience from your various reports in. So what do you think of those ones?
Yeah, like you see these trucks, they have a regulatory body. They need to do that. Because before a truck is carrying water, there are standards at which that truck needs to meet before taking water to people to drink or use it for their daily activities. So in this case, the body has that responsibility to do that. But you know, a lot of things are not really gone the way they are supposed to be because of some sharp practices. So you see where a tanker is not really that of standard to deliver drinking water, but because maybe of connection, or maybe they have paid their dues, they've paid what they are supposed to pay, and then the inspection is not well done. So in this case, the persons responsible to regulate this have failed the people, because the people want, what they need is water. And once they see the water, they jubilate and they collect the water. So the people that are supposed to check the standard have failed them. So in this case, they might be taking the water thinking they are getting water from the bowl. How do they call it?
They say water board, borehole.
Water board.
And they feel like it's the safest
it's
water
a safe
to
one,
drink.
but then it's not, because the tank itself, is it clean enough? Is it of standard to give you drinking water from? So in this case, they may be thinking they are taking safe water, but the regulatory body has failed them on that part.
So do you see a future where we'll have clean water? Looking at all these challenges that are on ground, do you see a future where we'll have access to clean water that would help us stem all these disease spikes? Talking about, there's even tuberculosis there, there's diarrhea there, you even just talked about it. So, and now cholera is there. They're even telling us, don't drink zobo, don't take kunu except you trust the source, don't even eat out because you're also putting your health at risk. If you have to eat food, ensure that you boil the water properly or make sure that you cook the food properly to avoid some of these things. Do you see a future where it will get better? Not just with government, but also citizens, especially in terms of behavioral attitude towards some of these things.
Absolutely, yes, because I'm an optimistic person. So I will say yes, because you will see, like I said earlier, if we leave everything into government's hands, sometimes it may take a while.
True.
Like going by the report of World Bank, you see about 60 million of Nigerians, they lack access to safe drinking water. And then you are talking of about 100 million of them that lack access to safe sanitation facilities. So when you are talking about this thing, yes, when will government do this? And looking at our SDG Goal 6, we were supposed to meet the target of every citizen getting access to safe drinking water by 2023. 2030.
Yes.
2030, yes, sorry. So by the time you are looking at this, if government has in the last 7 years gone to this point and we are still having this population that lack access to water, if you leave this to government's the ball into government's court, when are we going to attain that level? So this battle can not only be left into the government's hands. They need to be community involvement. They need to be community involvement, and even there need to be a collaboration between government and non-governmental organizations to ensure this, because they go further than where government will. So they know what can be done and how these people can get access to this clean water. So if this collaboration is standing and is effective, then I believe we can attain this SDG Goal 6 by 2030. And then the society, the community themselves can also see how they can provide some form of clean water to themselves. Communities can also bring up projects that can help the other members that are not buoyant enough to get to that level, to access clean water. So by so doing, everybody will not be left behind, because only them can see what the government may not see sometimes. So I think with this, we will be ensuring to have a clean water by 2030 to all citizens.
Okay, so what about the citizens' attitude towards embracing this?
Yes, that is what I talk about, that community involvement.
Okay.
They can educate.
Okay. They
can educate. And through that education, you change the mentality of the people's thinking. Like, for instance, let me digress a little again. We were talking about these railway tracks, where government have fixed railway tracks. It is for our own good. Absolutely. It is to ease our movement. But then there are some citizens that feel to remove those tracks and sell to make money is their own priority. And by the time you do that, The development is not only the government that is feeling it, the citizens are also feeling it. Because if that rail track is there, it's not the government alone that will travel on them. So the same thing with all the water and the overhead tanks and the boreholes that government sinks in communities. There was a community I visited while I was doing a report, and I discovered there was a very massive borehole and overhead tanks that UNICEF dug for that community. But because there was no light, based on due to insecurity, according to them, Boko Haram punctured their transformer. The community cannot provide a gen to pump water. They abandoned it. So you see, most times government use money. The non-governmental organizations use money to bring access to safe drinking water for community members. But the community, the little one they can do on their own, they don't do. So they need to change this narrative. They need to, at least where government have done and there's at least some gaps, they close it up. Because they are the direct beneficiaries of this project.
And this is definitely a community work, because if you and I don't put our hands into this, I don't think it will ever work.
Absolutely.
So in closing up now, I would like to get your rounding thoughts. What would you like to leave our audience with when it comes to access to clean water and how they can keep themselves safe?
Okay. Like what I will say to them, like most especially, I will say in terms of empowerment, our women especially need to be empowered. And when they are empowered, we will ensure that the family is safe. We will ensure that there is access to safe drinking water. And also, I would like to advise Nigerians that we should change our mentality towards looking at government projects that we are supposed to be beneficiaries of it as government projects. We should take ownership of this project, especially when it comes to we benefiting from it.
Thank you very much for your time today, Miriam Gom. We really appreciate you for your time. I'm still amazed at how you switched, but it's really beautiful to know that an economist is not a health reporter, and I like the passion that you put into this.
Thank you.
Thank you so much for your time today. We really appreciate you.
Thank you. I'm grateful.
All right, viewers, I'm sure you learned a thing or two today. Ensure that you prioritize the kind of water you drink. You've heard it from her. Communicable diseases are very real, and they could just be at your door. You never know, and do not think that your water is extremely safe. She just said it, even tap water is not safe, except you actually maintain it. I am Olamide Alhassan, and I'll see you again later. Bye for now.